Swayam Prabha. Digital India. Educated India.
Welcome to the course Nutrition for the Family. This is the fourth module in which we are studying about the nutritional care for the females during physiological stress. And this is the third lecture in which we shall be focusing on various aspects of nutrition care during pregnancy. I am Dr. Jaspreet Kaur, presently working as Associate Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayam Prabha, MHRD, New Delhi. In the second lecture, we had studied about the functions of placenta during the pregnancy. We also studied that what is the effect of maternal nutritional status before conception and after conception on the growth and development of the fetus. Then we studied about macronutrient requirements during the pregnancy. In this lecture, we shall be continuing about the nutritional guidelines for the pregnant woman, and we will focus on micronutrient requirements during pregnancy. And after this, we will study about other concerns related to pregnancy, discomforts and complications related to the pregnancy, and then we will also discuss about the healthy food choices and dietary pattern among pregnant women. So first of all, let's talk about calcium. Additional calcium, it is needed for the growth and development of the bones as well as the teeth of the fetus. Amount of calcium in a full grown fetus is around 25 to 30 grams, and most of it is deposited in the third trimester of the pregnancy. If the mother doesn't take adequate quantity of calcium through her diet and to meet the needs of the fetus, calcium from her own bones will be mobilized, which will result in demineralization of maternal bones, leading to easy fractures later in her life. Indian Council of Medical Research has therefore recommended that an EAR, estimated average requirement of around 800 milligrams, and recommended dietary allowance has been set at 1 gram, that means 1000 milligram, which takes care of the total calcium needs of the mother and the additional needs of the pregnancy. And provided the intake of all other nutrients, they are sufficient. So that is why no additional allowances are suggested by the team. And there are also evidences that increased absorption of calcium, it occurs during this phase. So this phase, as we know, is marked by many physiological changes. So as an adaptation process, the body of the pregnant woman, it absorbs more calcium. And the tolerable upper limit of calcium is 2500 milligrams. And this is pertaining to people who are taking some calcium supplements, as excess of calcium, it interferes with the iron and zinc absorption. So it is an important point that we should not go overboard on the calcium. Let's talk about magnesium. It is stored by the fetus, umbilical cord, amniotic fluid, and amnion. So to meet the requirements of magnesium, EAR of 370 milligrams and 440 milligrams of magnesium has been suggested as recommended dietary allowance during pregnancy. Another important mineral is iron. Increased iron, it is necessary for the fetal growth, expansion of the maternal tissues, including the red blood cells, then iron content of the placenta, and the blood losses during the parturition process, that is the childbirth process. Additional iron, it is also required to build the stores of iron in the fetal liver to last about 4 to 6 months after the birth. Since we know that the baby's first food, that is the milk, it is deficient in the iron. So there is also saving of maternal losses during this pregnancy. So keeping all these points in mind, the ICMR team has given an EAR of 21 milligrams daily. RDA has been set at 27 milligrams per day, whereas tolerable upper limit for iron has been suggested at 45 milligrams per day. Now, let us discuss another important mineral, that is zinc. It has an important role in the pregnancy. Apart from being a component of the insulin enzyme systems, it participates in the synthesis of nucleic acids such as DNA and RNA, which highlights its significance in the process of reproduction. Its deficiency during the antenatal period, it leads to adverse effects on the newborn, including fetal mortality, that means child death, malformation of the organs, reduced intrauterine growth. So it can cause low birth weight and preterm delivery also. This is a table showing zinc requirement for pregnancy and trimesters. Here, for average 10 kg total weight gain during the pregnancy during first and second and third trimester, or 12 kg weight gain during the 3 trimesters, the zinc requirements has been based on total basal loss, and then required for blood volume expansion, then zinc required for the fetal growth, and this has been total to reach the value of EAR and RDA. So the RDA for the maternal and fetal tissue growth we have just seen, it has been set at 12 milligram daily as an EAR and 14.5 milligram per day as an RDA. These values, they have been suggested based on the high phytic acid content of the diet which we Indians are consuming, that is rich in cereals, millets and pulses. So that is why the zinc requirement has been set at an absorption level of 25%. There are certain trace elements also, such as copper, manganese, chromium, selenium, which are needed for the fetal and mother accumulation. Its absorption is enhanced during the pregnancy as an adaptation process. Let us talk about an important mineral, that is iodine. Due to increase in the basal metabolic rate, the iodine needs, they are also enhanced during the pregnancy. So along with that, the fetal accumulation and other needs of the mother's body, iodine is needed. So the EAR has been set at 160 micrograms per day. The RDA suggests that the mother should take around 220 micrograms of iodine daily, and tolerable upper limit has been set at 1100 micrograms per day. Coming to important water-soluble vitamins which are associated with the energy needs, that is thiamine, vitamin B1, riboflavin, vitamin B2, and niacin, that is vitamin B3. They are not stored in the body because they are water-soluble vitamins, hence the regular supply is needed. Generally, the maternal levels, they tend to fall, and the fetal blood levels, they tend to exceed the maternal levels during pregnancy. And tryptophan to niacin conversion is also better among the pregnant women. So let us see their recommendations. For thiamine, the EAR has been set at 1.6 milligram day, and RDA has been set at 2 milligram daily. And coming to B2 riboflavin, the EAR is 2.3 milligrams per day and RDA is 2.7 milligrams daily. And about niacin, it is recommended that the level of activity that varies among women. So non-pregnant, non-lactating women, whatever niacin she is taking, she needs to add 2 grams per day in addition to her normal RDA. Let us talk about an important B vitamin, that is B6 or the pyridoxine. It is needed in the hypertrophy when the cells they are growing in the size, and in that case B6 is needed along with certain amino acids. It is used to control nausea in the pregnancy also. So pregnant women in our country, they often show B6 deficiency, which can be corrected through the diet, and usually the pregnant women, they take certain supplements of B6 for that. Let us see the recommended dietary allowance for that. It has an EAR of 1.9 milligrams and RDA has been set as 2.3 milligrams. And there are no side effects which were found in women taking supplements of pyridoxine, 200 milligrams orally or 100 milligram parenterally. So it has a high level of acceptance inside the body. Let us talk about folic acid. Because of increased hematopoiesis, that is increased blood formation, folic acid requirements they increase during the pregnancy. The recommended intake, it is based on the role in promoting normal fetal growth, in preventing the macrocytic anemia during pregnancy. So it has a potential role on the pregnancy outcome by preventing an important defect that is known as neural tube defect and such as spina bifida. So the ICMR has recommended an additional intake of 300 micrograms apart from the normal requirement of 180 microgram, and it makes a total of 480 microgram per day of folic acid by a pregnant woman. Now let us talk about vitamin B12, that is cyanocobalamin. It is needed for the fetal growth and accumulation and pregnancy needs of the mother. The fetus has a priority over mother in case of vitamin B12. Its lower levels they are associated with the premature delivery. The capacity to absorb vitamin B12 enhances during pregnancy, but its deficiency is likely in the vegetarians and the vegan mothers. The recommendation for B12 is EAR has been set at 0.20 microgram, whereas RDA has been set at 0.25 microgram daily. Let's talk about an important water-soluble vitamin, that is vitamin C. The requirement of vitamin C is quite high for pregnant women. Vitamin C, it can fully cross the placenta barrier. To improve the iron absorption and prevent the young infant from the scurvy, it has been suggested that additional 7 milligram per day of ascorbic acid is needed. Therefore, the recommendations say the EAR of adding 10 milligram to the usual vitamin C intake, and RDA suggests intake of 15 milligram additional to the routine intake is recommended during pregnancy. However, the tolerable upper limit has been set at 2000 milligrams, and this is related to the vitamin C supplements. A pregnant mother needs sufficient amount of vitamin A for the gestational weight gain and the fetal gain. So the recommended dietary allowance for the retinol has been set at EAR of 406 micrograms per daily, and RDA has been set at 900 micrograms per daily. However, the tolerable upper limit has been set at 3000 micrograms per day. Water, it is an essential component for all of us, and it is again very important for a pregnant female also. So to meet the needs of gestational weight gain, for the expansion of fluids inside the body, and other benefits such as prevention of constipation and prevention of dehydration, mother, she needs to include around 2600 milliliters of water from the beverages along with water coming from other food sources. Some of the mothers, they are having certain wrong food habits, and they have certain poor lifestyle which could harm their own health as well as the health of their fetus. So let us see what are these considerations and conditions which need attention. Drugs, if they are used during pregnancy, the reason could be medicinal or the recreational. It leads to numerous problems for the mother and for the fetus also. This can lead to malformation in the fetus. It is important for the mother to avoid excessive amount of this very commonly used stimulant at least during the pregnancy. That is caffeine, which can cross the placenta and enter the fetal circulation. Pregnant women who have been drinking coffee for in a much larger amount, they are considered at the risk of miscarriages, premature deliveries, and they may give birth to small for date babies. And therefore, the intake of caffeinated foods and beverages such as tea, coffee, cocoa, cola, and medications, they should be avoided. And along with that, there are certain beliefs, avoidances, cravings, and aversions among the pregnant woman. Food avoidances, they reflect mother's conscious choice not to consume certain fruits during pregnancy. Say the woman, they wish to avoid papaya or gingerly seeds, considering them as hot foods. And cravings and aversions, they are the powerful urges towards or away from the foods, which are, say, commonly craved foods are sweets and dairy products, which mothers they wish to take. Whereas most common aversions are, say, alcohol, tea, coffee, or caffeinated drinks, meats, and strongly spiced foods. They are also among certain foods which a woman develops aversion during pregnancy. And consumption of some non-food sources such as starch and then ice cubes or clay, etc., that is also experienced by some pregnant women. This condition is called pica. These behaviors, they appear to be based on the superstitions, customs, and traditions, and they often pass from mother to daughter, and they do not have some scientific reason behind that. So it is important for mother to see the facts behind any kind of food related behavior or choice. Another important concern is smoking of women. It contains harmful substances such as tobacco. It results in placental abnormalities and fetal damage, including prematurity and low birth weight. It is mainly due to the impaired oxygen and nutrient transport through the placenta due to reduced blood flow. Alcohol is another habit which can be really harmful during pregnancy, which can cause fetal damage. Extensive or habitual alcohol use may produce offsprings with fetal alcohol syndrome, FAS. It is characterized by four general types of abnormalities, that is low birth weight and growth retardation, then characteristic malformed structures. For example, there will be some anomalies in the eyes or nose, etc. Then impaired central or nervous system performance could result in some infants, and which will include mental retardation, and there could be anomalies in the body system of the fetus. During pregnancy, physical activity is really useful as it improves the physical fitness of the mother. It prevents gestational complications also. It supports healthy weight gain, and it improves the mental health of the mother. Walking is considered the most leisure time physical activity, and a mother can go for certain type of exercises which are safe for her and her baby, such as yoga, meditation, and simple stretching exercises along with walk. Let us talk about the important discomforts and complications during pregnancy. The occurrence of constipation, especially during the later half of the pregnancy, is very common. The contributing factors are hormones, and along with that, some amount of pressure which is exerted by the developing fetus over the digestive tract of the mother, and limitation of exercise could be one reason, or insufficient bulk in the diet when the mother's diet does not contain fiber in her diet, or insufficient amount of water taken, they can lead to constipation. Now, restriction of physical activity is not advisable. As we know, we have seen in the previous slides also that exercise not only helps in the elimination, but it will keep the body fit. Along with all these things, mother should include sufficient amount of fibrous food, whole grains in her diet, and she should take good amount of beverages to ease this condition. The occurrence of cramps, it is usually at night by sudden contraction of muscles. It usually results due to decline in the serum calcium levels related to calcium phosphorus imbalance. So supplementation of non-phosphate calcium salts is given, and reduction of milk is suggested in these cases, and magnesium supplements, they are also suggested to relieve the symptoms of leg cramp. Mother could feel mild nausea or vomiting. During the first trimester, the physiological and biochemical balances, they are often disturbed, possibly because of excessive hormone production. So the gastrointestinal upsets, including loss of appetite, nausea, vomiting, they are relatively frequent, and loss of weight occasionally takes place because of inability to take sufficient food, and early morning nausea, it may be overcome by using high carbohydrate foods such as rusk or dry toast or hard candy. They can be eaten before rising. It can be really helpful for the pregnant woman. And along with that, it is suggested that the mother should take small, frequent meals rather than the large ones. And fluids, they should be taken between the meal and not with the meals. And fatty foods such as fried food, desserts, sweets, excessive seasoning, coffee, and strongly flavored vegetables, they should be avoided or eliminated if the nausea persists. Sometimes pregnant women, they complained about a feeling of fullness or the heartburn. Such complaints or discomforts, they are generally felt after the meals. They are usually due to the pressure of enlarging uterus crowding in the stomach, therefore causing difficulty after eating. Food mixes may sometimes be pushed back to the lower esophagus, which causes burning sensation due to gastric acid mixed up with the food mass. And the complaint, it has nothing to do with the heart itself. This is feeling due to the closeness of the lower esophagus to the heart. This feeling can be avoided by taking small, frequent meals. Edema is accumulation of fluid in the body. Estrogen, progesterone, they cause various body tissues to retain fluid during pregnancy. The usual increase in the blood volume during pregnancy and pressure of enlarging uterus on the major veins, especially the inferior vena cava, it can cause edema. Mild edema in hands and lower legs and feet, they usually require no intervention. To relieve these symptoms, elevation of feet, it is recommended. A mother can keep her legs over a pillow, and the symptoms, they will subside. Careful monitoring, it is needed in case of generalized edema happens. So medical help should be sought. Pregnancy-induced hypertension is another important condition which need special focus. Formerly called toxemia, the term toxemia meant to be a combination of symptoms including hypertension, edema, and albuminuria. Albuminuria is presence of protein in the urine. So during pregnancy, hypertension may occur, which could be mild or severe. In the mild cases, the blood pressure, it is raised mildly, that is slightly raised, that is 140 by 90 millimeter of mercury. So it is a common condition. So it is generally not considered serious. But in the severe cases, the BP is over 160 by 100 mm of mercury, and it has a great risk to mother and the fetus. Preeclampsia. It is the appearance of hypertension, edema of the face or hands, and it could be accompanied by the albuminuria, and this happens at about 20th week of the pregnancy. It should be suspected when there is sudden gain in the weight, including fluid retention rather than the tissue building in the mother. So eclampsia, it is the end result of preeclampsia. It includes all these earlier symptoms, that is edema of the face and hands, but it leads to convulsions. Now, in this condition, since it is a very serious condition, early diagnosis is very important so that it does not harm the mother and the baby. For mild cases of this pregnancy-induced hypertension, salt restriction it is advised. In the severe conditions, hospitalization it is needed, and along with that protein or calorie restriction or the sodium restriction, all these are recommended to some women based on their medical conditions. In our country, majority of women suffer from anemia. It is responsible for high maternal mortality, premature birth, neonatal deaths due to poor growth and development. Hemoglobin concentration they gets low because the plasma volume during the pregnancy it expands, so that is why physiological anemia occurs. And women with the inadequate iron stores or due to faulty habits, due to non-availability of iron, folic acid, vitamin B12, it can lead to anemia. Now this type of anemia, it can be prevented by including good quality proteins, iron, B complex vitamins and vitamin C in the diet. Gestational diabetes is another health concerns which need attention. It usually develops during the second half of pregnancy. Here the placenta produces hormones which counter the insulin hormone. This hormone regulates the blood sugar level inside our body. If not treated well, it leads to large infants and many complications for mother during pregnancy later in her life. It is important to monitor the blood glucose levels regularly, and fiber-rich diet, complex carbohydrates, low fat and sugar diet, it is usually prescribed to control the blood sugar of a pregnant woman. Now this takes us to the next section of our lecture, that is healthy food choices and the dietary pattern during pregnancy. While planning meals for the pregnant woman, the basic meal planning principles they remain same as for all the adults, but the main focus should be on the nutrient density of the food. So that means the quality of the food. The mother often suffers from the morning sickness due to hormonal and physiological changes. So the woman should be given small amounts of food with increased frequency. Solid carbohydrate foods such as biscuits, bread, or fruits as the first food in the morning as well as before meal, they will help to relieve the nausea of early pregnancy. It is important that mother should avoid rich, fried, strongly flavored, and highly spiced food which may cause nausea or gastric distress. During the first trimester, the mother's nutrient intake, especially energy, it need not to be increased because the BMR is not that high. But to meet the increased requirement during the second and third trimester of the pregnancy, the mother needs to consume certain extra food. She should be given some snacks in between the main meals rather than three large meals. Thus, increasing her frequency of feeding is more important. The feeding pattern should be taking 5 to 6 meals in a day. As we know, pregnant woman needs extra proteins. So these protein needs, they can be met by including the protein of good quality like milk, meat, eggs and fish. So protein, it can also be obtained from certain foods such as pulses, groundnuts, soybean, etc., which are comparatively cheaper sources of protein. To improve the protein quality, the combination of plant proteins like cereals and pulses along with small amount of animal protein should be used. So it has been recommended that the diet should contain 3 parts of cereal, 1 part of pulse and 2.5 parts of milk to achieve a good protein level of that means quantity and the quality. To meet the additional iron needs, foodstuffs like whole grain cereals, whole pulses, some leafy vegetables like mustard leaves, bathua, etc., dry fruits, eggs, and organ meats, they should be consumed. And a mother should take raw fruits and vegetables to meet the vitamin C and fiber requirements. And the diet, it should contain optimum sodium. In case of hypertension and edema, the table salt or the salt which we put in the dishes, that should be restricted. During pregnancy, due to fetal pressure, constipation is a common problem. Therefore, large quantities of foods which are rich in dietary fiber, that is fresh fruits and vegetables, whole grain cereals, husked pulses, along with plenty of fluids, it is needed to be included in the diet. And too much of tea and coffee should be avoided. And the diet should contain sufficient flax seeds and soya beans to meet the N3 PUFA needs of the body. The mother should take the fluids in between the meals, and the fluid, they should not be taken with the meals, as they will be filling the mother's tummy and she will not feel like eating the food after that. Her diet on a whole should be nutritious and well balanced, and faulty beliefs and wrong food habits, they need to be corrected during the pregnancy. And stress, anxiety, fatigue, and other psychosocial characteristics, they may influence the food choices of the woman. Therefore, mother should practice certain breathing exercises or the calming exercises to ensure that she takes sufficient amount of nutrients for herself and her baby. Now, this is a table which has been given by the RDA 2020, Indian Council of Medical Research. As we can see in this table, there has been suggestion given for a vegetarian mother and a non-vegetarian mother according to the base of EAR and RDA of all these nutrients, macro and micronutrients. And along with that, there has been a recommendation regarding cereal and millets that a mother should consume 325 grams of cereals and millets. She should consume 90 grams of pulses. She should take 100 grams of green leafy vegetables daily and 200 grams of other vegetables. 100 grams of fruits and tubers, excluding potatoes, should be included, and fruits should be taken around 150 gram daily, and she should increase the amount of milk, that is around 400 ml daily, and along with that she should take healthy fats, that is around 25 grams of fat should be taken, and she should take certain healthy fats from the food sources by consuming gingery seeds and peanuts. Around 40 gram of food of this origin can be taken, and then she should include spices in her diet. So this is about the planning a healthy balanced diet for pregnant women. So let's summarize what we have studied about the nutrition care during pregnancy. In the first lecture, we had studied about the various physiological changes which occur during pregnancy. Then we studied the effect of these physiological changes on the nutritional status and nutritional needs of expecting mother and her fetus. Then we studied about the developmental stages of pregnancy. In the second lecture, we studied about the important organ, that is placenta, and its importance. Then we studied the importance of mother's health during the preconception phase and the pregnancy period on the growth and development of the fetus. And then we studied about the nutritional requirements of the mother, in which we studied about the macronutrient requirements. Then in this lecture, we studied about the micronutrient requirements during pregnancy. We studied about certain concerns regarding the faulty food choices and habits. Then we studied about the discomforts and complications associated with the pregnancy. And lastly, we studied about healthy food choices and dietary pattern during the pregnancy. So this finishes our this lecture about the nutrition care during pregnancy. We shall continue this topic ahead and where we will be talking about the nutrition care during lactation in the coming lectures. Thank you very much.